Welcome back to That's Not Proper, and I'm your host, Corey Ascension. On today's episode, we are going to be talking about the pelvic floor physical therapy, pain-free and pleasurable sex, and how those two correlate. We're also going to be talking about body image issues and some other issues that we as women may have in the bedroom. So please enjoy today's episode of That's Not Proper. My guest today is Dr. Lauren Crigler. She is a doctor of physical therapy and she specializes in pelvic floor physical therapy. She has 11 years of clinical experience and has lectured in many hospitals in the U.S. and several times in Ecuador. Just found that out this morning, actually. In addition, she aids women in sexual health and wellness by helping them to have pain-free and pleasurable sex. Thank you so much for coming on today, Dr. Lauren. How are you doing?
I am doing great. Thank you so much for having me.
I was very excited that I saw your post when we were in that forum together, and I'm so excited to have you on today because there's a few things on here that you are a professional at that I had never heard about until the last couple years. And so it just thrilled me. And then in addition to that you are out there aiding women and empowering them to break these traditions and norms with regards to sexual pleasure and desire and pain-free sex and things like that. So a lot of stuff that women pretty much think we just have to deal with and struggle with. And I love it. So explain exactly to us that have zero medical terminology skills. What exactly is pelvic floor physical therapy?
Okay. Well, first of all, physical therapists are considered the expert in movement when it comes to the medical field. And so movement and function is where we really thrive. And so when we talk about pelvic floor physical therapy, then we're talking about the movement and function of your pelvic floor. So the pelvic floor is just everything in between your legs. And so your ability to contract those muscles and relax those muscles and for your body to sense the outside world in one way or another is essential for a lot of different functioning. Actually, it's not just sexual, but for urination and defecation, pee and poo. Let's keep it simple, right? We have kids, so it's like, when you
right, yeah,
go pee or poopy or,
yeah.
And sex, it's like all the ins and outs, literally. And our knowledge base is around helping people have all the function, have all the abilities that they want to have.
I think a lot of times I don't even know if we correlate that there is when we're having issues in these areas, that there's actually the ability to do something therapeutic that could actually solve a lot of problems. And that's what floored me when I first
Yeah.
Great pun. When I first found out about pelvic floor physical therapy, I was like, wait a second. This exists. I don't have, the idea of having to live in this pain or struggles that we have in those areas, especially after having children, was mind boggling to me. What I really find interesting though, is that you have recognized the need for women to overcome the struggle with this. And so at what point did you recognize, was it when you first started school or was it at some point after you had already finished and had become a doctor that you recognized women needed to work on as far as, the pain and the lack of desire and the struggles that they have when it comes to sexual intimacy and wellness and health?
Well, when I was getting my doctorate, that's when I was first, introduced to the pelvic floor and its functioning. And then when I started it's one thing to learn something in class, but then when you are taking that knowledge and you're going out and asking people, anybody that would talk to me about their issues, and you realize that if you start talking about incontinence and constipation and pelvic pain, like chronic pelvic pain that you might have all the time, or pain with sex, if you start talking about all those issues, you've touched almost every single woman. Like you've touched on something that they say, oh yeah, me too, whether they're in their 20s or their 80s and every age in between. So that's what got me really excited about working with that population. And then, as we talk even more, we realize that there's another need that I think you're kind of touching on, that women don't want to talk about it at all. Don't want to, they want to pretend that that area doesn't exist. And that's part of the problem.
Right. And that causes me to think about the struggle that a lot of women have in discussing anything with regards to their body. We've got a society, I think, that's coming around now with regards to the discussion of sex, but it is really not something that is traditionally and normally something you would talk about. And so when you have these issues and if you've been led to believe, at least that's what my opinion is, been led to believe this is normal, so you just have to deal with this until you're dead. I don't even know if it's something that we necessarily consider thinking about. You think, well, this is just how life is, and who in the world even discusses this anymore anyhow? Do you have a lot of women that come in and that's a similar type of mindset that they have?
Yeah, I think it goes actually to both extremes and they both cause inaction. There, I see one type of woman that says, I think that this is just normal. Everybody experiences it. And a lot of times that's typically because that's what their mother or their girlfriends have told them who have already had kids.
Mhm.
And they say, like, oh, well, sex just hurts now, or, you're always just going to leak a little now. Like that's pretty normal now. And they hear that and they think, well, this is happening to everybody and there's nothing we can do about it. And the
Right.
other side of that is people who don't talk about it at all with anybody, and they think that they're the only ones, and therefore there's nothing
Mm,
that they can do about it. Because if you're the only one in this
mm.
world with this problem, then surely nobody's come up with a solution, right?
Well, and it would be embarrassing to discuss. It's not something that we openly discuss anyhow. So obviously, it would be difficult to discuss. What's blows my mind is because I had this struggle with incontinence and all that. I had a prolapsed uterus, blah blah blah. And so I had a hysterectomy and I had bladder surgery. But at the time when I was having all these things, I didn't think that there was any way to deal with it other than surgery. I heard about Kegels, and I felt like I did Kegels till out of my mind. And
Mhm.
so it didn't do a whole lot for me. Now, to be fair, I had 7 kids. How often do you think that a lot of women think that surgery is the only option?
I think that that is probably pretty often because that's what, if you were to Google it, that's going to be your top, 100 hits that come up. Um, and I don't see it as an either or type of scenario. I always like to describe it as, it's like, a lot of women might not have a hysterectomy. They might have a bladder lift. They'll have it, they'll have their bladder and uterus sometimes tacked up, or their
Mhm.
uterus removed and their bladder tacked up. And I always describe that as it's kind of like if you had a boat at a dock and you have strings attached or ropes attached right to the dock. Those ropes hold your boat in place really well, right? So in the surgery, they are attaching more ropes and shifting it around and putting the ropes there. But if you were to take all the water out of the marina, those ropes are not holding your boat up. They're just holding it in
Right.
place. Does that make
Okay.
sense? And so the
Yes, it
the the
does.
dock and everything would collapse, right? So if we don't
Ok
have, and the
right.
water in this analogy is your pelvic floor. So if we don't have the strong structure underneath to hold everything up, it's not going to last very long when you just create more ropes, right? So
Okay,
it can
and
be very beneficial to have surgery. It's just that you should also make sure that the structure holding it up is also strong.
I think that that's interesting because I think a lot of times we think with various issues that we have, whether it be as men or women, surgery is the only option. I don't think we recognize this. My partner recently was talking to me. He's like, I'll go to a physical therapist now before I'll go to anybody else because he's just seen the benefit from that. With regards to different things that women that are struggling with this, like I had mentioned Kegels. And so we hear a lot about Kegels. Can you explain to us what Kegels actually do? And are they the best thing? Are there other things that we can be doing?
So it depends on what the problem is and it depends on the source of the problem. What Kegels are is it's a contraction of your pelvic floor muscle, right? So if you were to,
Mhm.
one of the cues, as funny as this sounds, is like imagine that there's a straw in your vagina and you are trying to suck up
Mhm.
the straw. And the reason we use that cue a lot is because the muscles not only would close around the straw, they would actually lift up a little bit because it's shaped like a bowl. So contraction of that bowl would cause all the fibers to rise. depending on the source of your problem, if your problem is that your muscles are just completely lax and have no strength and they have no tightness, then getting a Kegel to work would be really helpful. But a lot of people that I see, actually, their problem is that their muscles are too tight. So,
Oh.
one of the biggest struggles, one of the biggest
Mm.
misconceptions that pelvic floor physical therapists try to fight is that we should all be doing Kegels all the time and that you should stick a Benoit ball or, the egg or whatever they have different devices that you're going to stick in your vagina and then
Mhm.
hold this and do contractions for 30 minutes. And like the chances that that might create pain are pretty high. And if you already have pain, you absolutely should not do that. So,
Okay. Wow. It's
so I
that
have some
I'd
people that are
never
like,
now.
Kegel, Kegel, Kegel. I
Yeah.
tell all my friends to Kegel. And I'm like, no, 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 no.
Yeah, that's I mean, it goes back generationally speaking as well. I think my grandmother said it, my mother said it, and obviously they had probably heard it, prior as well as Kegel, Kegel. In fact, when I said Kegels to you and then you started explaining it to me, I literally started sitting here doing it. It was just like an automatic response. So I'm like, oh, stop that. But
So are all your listeners.
yeah. But so okay, but let's go bit beyond that just a little bit. I'm curious with regards to the medical community. Now, your husband is an OBGYN,
Yes.
and so you have two doctors in the house. What I would like to know is if you guys are seeing that the medical community is recognizing that women are kind of stuck in these traditions and norms, and they, as the medical community, since that's who we tend to listen to, are recognizing there's a need for women to be more comfortable to discuss this, and our physicians stepping forward and like opening up that conversation.
Well, first of all, I want to emphasize that, my husband and I work together a lot with some of our patients. And so we see our care as
Oh,
really
okay.
being complementary, not opposing. And so, for example, if
Oh, wow,
somebody's
great.
struggling with low desire, it might be there's some vaginal dryness issues that are occurring because of low estrogens. Um, in the vaginal canal, he might prescribe a compounding cream for that. I might work on relaxing your pelvic floor muscles so that your central nervous system calms down and you get more lubricated in that way and get more excited in that
Mhm.
way, or, things like that. So, and talking about relationship issues so it's all, I see that all as complementary. But as far as
Mm,
the medical community goes, I I think that if you took a sampling all over the place, you would have very different results depending on where you sampled, not only in region of the country, but in medical office to medical office, and even physician to physician within medical practices, because
mm,
you have people who come from very different backgrounds. Some of that is
mhm,
generational. So, if we were to stereotype, I think that, we look at younger physicians, younger generations, that there's a little bit more comfort in talking about sex,
mhm,
just because of the era that you grew up in when it was very, very taboo. I probably grew up in an era where it's a little less taboo. I think, my hope is that people feel more and more comfortable. Another thing just to touch on is that it's one thing to ask the medical community to come around to being comfortable talking about it. It's another thing to ask insurance companies to be comfortable reimbursing for it.
good point. Yeah, I was thinking that I think is on a lot of people's mind right now, especially with everything that's going on with the coronavirus and everything, is what's gonna happen with regards to insurance. Gosh, I was trying to think about over the past how many times I had been asked by my OBGYN with regards to, like, my sex life or anything like that. I don't think, and my oldest child is 28. Not one time has that ever been discussed or asked or anything. It was pretty much, "Oh, you're pregnant? Oh, look, Corey, you're back again?" And then it was, "Okay, 6 weeks," or whatever. I had one doctor tell me 2 weeks. I told him he was crazy. So, after the baby was born. And it was, "Do you want any, pills, or do you want, a diaphragm?" Or there was no discussion about, even after I had my hysterectomy, there was no discussion about the struggle, because part of the reason I had the hysterectomy was because of pain, severe pain. And so, well, I had a prolapse uterus, so that makes sense. But I don't think I've ever
Right.
asked. And I think that that's interesting,
That is
that.
interesting because the chances that, a woman would have pain with sex if she's having pain with prolapse is extremely high. I would assume that she's having pain
Yeah.
with sex. So to not start that conversation, I hope that this will become something that we will think of as negligent. But at this point in time, I think that there is a discomfort in the medical community. I also think that there is a lack of knowledge in the medical community. And I also think that there is a discomfort in the community at large that some physicians are sensitive to. So,
Mm.
my husband and I obviously we have a lot of friends that are in pelvic health. And when we
Mm-hmm.
talk to them, they say, like, especially my husband being a male OBGYN, they say, you know, are your patients ever offended that you bring up sex? Because he asks every single woman, if if she just had a baby or she just had a surgery, like you mentioned, in follow-up care, one of the questions he would ask is, are you able to have sex without pain? And they're surprised to hear him say that women are not offended. Women feel
No.
very honored that you thought enough of her to ask about an intimate and important part about her life.
Well, and that to me seems to make sense because it would be the one person that's, not in your family circle or friend circle where you may feel judged or whatever. There's a lack of judgment there. And then you're going to get some medical advice that's going to be a little bit more sound versus something that a girlfriend or a family member, might give you. And yeah, I had never been asked that. And part of it too, I wonder if it just has to do, like we had discussed before, you and I had talked before with regards to tradition and norms and the struggle for everyone, not just the medical community, to become comfortable discussing sex and desire and pain and pleasure and how much and how often and when there's issues, how can we deal with these issues? And then we are stuck in a situation when we don't have any answers to that or don't think that there's any answers out there to that, where then your relationships struggle, you struggle within yourself with depression and shame, you feel shameful, and then body image, all these other things come into play then. And one thing that is amazing to me that you also do is you work with partners together within your business, and I'd love to hear a little bit about that. How do you incorporate that?
Well, part of it is helping partners start with conversation about sex. So a lot of times women will come to see me and there is a pretty good chance that she has never talked about her problem with her partner. So if it's
Hmm.
pain or if it's low desire, they often don't really talk to their partners, or especially with the pain, their partners might be aware of the low desire because they might have noticed that they're getting rejected a fair bit.
Hmm.
But they don't know why. They don't know that it's not that she doesn't love you. It's that she's having low desire, and this is something that we can actually work on. And so, starting that conversation is
Hmm.
probably one of the most valuable things I do for couples. And then, doing kind of a deeper dive with, are there certain things that trigger her depending on her past that might cause her
Hmm.
to not want to be sexually active, and avoiding those triggers or soothing those triggers? And are there things that would increase her desire, right? I mean, it's always like, well, what makes
Hmm.
this problem better,
Right.
and how, the partner can do that. And then also, I talk about hands on techniques. So if you're
Hmm.
having pain, there's a lot of techniques that you can do. Could help somebody in a clinic, but it's just as easy for me to hold up a life-size plastic model of a pelvis with all the muscles and everything in it and point to where we're talking about and actually be able to
Hmm.
tip the pelvis forward where they could see the inside of the pelvis, which I can't do with a live person, right?
Right.
So
Right.
it actually makes instruction easier when you have a plastic
Hmm.
model that we can like decapitate and then look inside,
Hmm.
you know? Um,
Yeah.
and all of that. And I think the process, one of the things that I get really excited about that I noticed for years is the process of going through solving the problem together. When those couples go through it well, they come out better than I believe, than they ever would have been if they hadn't had the
Mm.
problem in the first place. Because now, imagine now you had a conversation with your partner where they know every inch of all your stuff,
Hmm.
and they know,
Inside and out.
yeah, and you're in your mind too, and they know your triggers, and they know it's like, gosh, we should all be having like these conversations, but it's not until people have problems that they typically do.
How do the men respond to that initially? I wonder if they'd be a little bit less receptive initially when having these conversations with you and their partner there.
Uh-huh. Well, so yes, men typically they come in like a little awkward. And if I'm looking at somebody on a computer screen, I can still, you can like you can feel it.
Right.
Um, so I actually have, depending on their profession or their hobbies, like what they're into, I'll kind of try to
Mhm.
relate it to something that they do. Like I was talking to an engineer recently and I said, so basically we need to lower the coefficient of friction and he was like
Mhm.
chuckling, but I think it put him at ease because it was like, "Oh, you're speaking my language for, as
Mhm.
a mechanical engineer." Um, and not saying like, "Oh, well, what you really need is some lube," you know.
Yeah. Well,
But, you kind of like dabble in some of what they're used to and then mix in what they're not used to.
what are the most common causes of painful sex for women? I
Mm.
mean, other than obvious things like, okay, that was too rough, but I mean, just like, what are the common causes?
Right. So after childbirth, one of the main causes is scar tissue within the vaginal canal or within the pelvic floor. And that's
Mhm.
something where I'm very much teaching on hands on techniques to people. And then around perimenopausal times, vaginal dryness and atrophy, which just means everything down there is a little shriveled. Like, that
Oh.
doesn't, it doesn't sound good, but it's a little bit more like a prune, a little less like a plum, but
So moisturize with lube.
well, and that's where, an estrogen cream, talking about complementary things, could actually plump up the tissues, not just make them more slippery. So that's
What is an estrogen cream? Explain to me what that does. I've never used anything like that before. An estrogen cream. What does that do exactly?
so estrogen is one of the things that makes our tissues more plump, like more vascularized. They have more blood and
Hmm.
things are flowing more. It's more of like how we are when our bodies are more youthful. And when
Hmm.
estrogen lowers, you're going to have tissues that have less blood flow, and they will kind of get smaller, like
Okay.
you know.
Kind of
Um,
like your cheeks as you get older and they
yeah.
get sunken in.
Yeah, yeah. So, I mean, I never want to scare women. It's like these are normal changes and they're not huge. And I never want to give a woman another reason to worry about that area or think about how it looks. I mean, nobody
I
feels
just love the
okay.
idea of knowing that there's things like that available because honestly, I didn't. And I'm reaching that age. I hate even saying I'm gonna be 50 in a few years. I actually have to say a few. I can't say in lots of years. In a few years, I'll be 50. And I know these things are coming. And so to know that there's options out there for me is hopeful for the future. So when I asked that about the estrogen, I was like, oh, I've never heard anything about that. I wonder if I'm going to need that one day. Lube and things like that, we're all, everybody's pretty much aware of them. I'm hopeful that a lot of people are using lube. I mean, you talk about things too with regards to, I noticed this on your website, lube and toys and things like that, and incorporating those into relationship to help increase desire and intimacy. And and so with regards to those things, those aren't things people like to talk about a lot though. And so, the community that I grew up in, especially even beyond growing up as I got older, well, first of all, sex toys was only for, bad people. So the idea of bringing toys into the bedroom and that you encourage that within your practice is interesting to me. Share a little bit about that with me.
Yeah, so I think, as far as the, sex therapists and sexual coaches, and there's a full range of what people recommend in general. And so sometimes people might have this idea that sex toys means that I'm going to be suggesting that you're, tying your partner up and whipping them and and all this crazy stuff. And not that that's
50
crazy.
Shades of Grey.
Yeah, I mean, it's, I'm very non-judgmental. So, and I go through a sexual menu with people so that they can sort of check off things that they're interested in, not interested in. I kind of get a gauge and where they're coming from. What I'm talking about is less than that. It's a little less than that. Something that, um, uh, to use a vibrator or to use something that is going to cause more stimulation to the clitoris, especially. Although
Mhm.
for some women, and men, it may be like vibration or sensation around the anus. I mean, it's just, this is where we have a lot of nerve endings, people.
Mhm.
So
For a
to
reason.
deny that and say, I
Mhm.
mean, and if you're having orgasms and you think sex is amazing and fantastic without using any toys, and this is what I'm saying is not for you at all, that's totally fine. I think that's great.
Mhm.
I'm happy for you. But if you're sitting at home going, do I have orgasms? I'm not really sure. Or, man, I wish I could have an orgasm in less than 30 minutes.
Mhm.
This, there are things that you can do to change that. And yeah, and I wish it was seen as not dirty. It's just useful, right?
Mhm.
You're trying to get somewhere and it helps you get there.
Yes, and then how many, patients do you have come in, especially women, well, gosh, maybe even men, but don't recognize that a lot of stimulation for women is not coming actually from penetration as far as orgasm is concerned. How often do you find that they don't recognize that?
I think that it's pretty common. The other thing that I think is interesting is whenever I mention a vibrator, sometimes, with people who feel like penetrative sex is just the one kind of sex that they want to have, which is a whole nother topic, uh, but they'll say, "Well, I don't want to use a vibrator because I want to be having sex with my husband." I'm like, "Exactly. You can do both at the same time." And sometimes you see the wheels in their head turn, and it's like, I'm not talking about something that goes inside you necessarily. There you can use the vibrator on the outside, right? And still be having sex at the same time.
The idea of toys, at least in the past to me, and it's really still something I'm coming around to understanding, but it was something that I thought even just lube is it going to make your partner feel as though they're less than, that they're not doing a good job? And again, I think that comes back to traditions and norms that we're told that there is this one way, and he goes in and he goes out and he goes in and that's it. And and there's nothing more than that. But the idea that incorporating different types of things, I think a lot of people struggle with making sure their partner feels sufficient, because you don't want you want to feel as though you've performed well. So I wonder then how many struggle with the idea that, oh, bringing this into the bedroom means I'm not up to par in this area.
Mhm. That is something that, I have talked some men through sometimes. Um, and one of the way, it really depends on how you talk about it, right? So if you're saying, I want to be having sex with you. And also at the same time, I'm just totally aware that like 95% of my nerve endings are in the clitoris. Like,
Mhm.
um, and I want to really enjoy it. What I think is really consistent from the men that I talk to is that they want their partner to be pleased.
Mhm.
They want their partner to have an orgasm. And for the 5% that don't, a quick explanation of if she has an orgasm, she's going to want to have sex with you more, gets them there right
Mhm.
away. Right. And so
Right.
now they're on board. It's like you want your partner
Right.
to be pleased. And
Mhm.
it's not that it's not pleasurable to have, penetration. It's just that it might not be like the the straw that broke the camel's
Crescendo.
back, right? Like you need that
Yeah.
extra, like, I just need more. And sometimes that's
Mhm.
actually a key phrase that I will give women. So for people who are uncomfortable talking about sex, which is probably most of my clients, one of the ways I make it comfortable is that I always say, you are not going to be leading this conversation. Like, I'll lead the conversation and I know where it goes. And there's never going to be this awkward silence because I know what to say next. And on top of that, I'm going to give you phrases to say that you are comfortable with. And that's not for me
Mm.
to say, that's for us to come up with together. I have suggestions obviously, but one of the things that women aren't comfortable with is, so they
Yeah.
aren't
Mhm.
necessarily comfortable saying a lot of things, let's put it that way, but they are comfortable maybe saying, I need more. And when
Mhm.
she says, I need more, that means I need more stimulation. And then we've kind of mapped out where on her body she feels most stimulated, right? Or the
Mhm.
other thing is, I'll say, if you're not comfortable saying something, you might be comfortable using your hands to direct him somewhere else. right?
Okay.
And
Mm-hmm.
most women have probably noticed that men don't have a problem with directing their hands, right?
Yeah.
Or using you, like directing you to what they want,
Oh. Mm-hmm. Mm-hmm.
Like
Yeah.
if you've ever had,
Yes.
the whole, here's where I want your hand, and they just pick it up and put it there, and you're like, oh, okay, well,
Yeah, there you go. Well, and
that's
that's a
what you
turn
want.
on in
It's
a
like,
sense too. That little bit of take control of the situation and show me. Yeah,
mhm.
absolutely. Oh gosh, think about that one. Um, so the other thing that I wanted to talk to you about too is, a lot of women I think struggle with, body image and feeling shame, and um, then I think that ends up what comes of that is lack of desire, and I put that in finger quotes. And then so sometimes I wonder, is it actually lack of desire, or is it like different desires, or is it struggles in this area so it's coming out as lack of desire? And do you address those things with regards to your practice?
Yes, I do. And so that's interesting that you mentioned that, because it is kind of a double whammy for me. Like most women um, have issue, well, a lot of women anyway, have issues with body image in general as a whole,
Hmm.
right? And so it's either too fat or too thin, or your thighs are too jiggly, or your belly is too, poochy, or whatever it
Right.
is.
Hmm.
It's something about your body in general. So they don't like strutting across the pool, deck in their bathing suit.
Hmm.
And the extra layer that I'm dealing with is that they have issues with their vulva and vagina and that whole area, because they've been, I don't want to say they've been taught necessarily, not directly, but through society and through their parents and, everything that they've grown up with. It's that we're uncomfortable talking about this area. And so if you're uncomfortable
Hmm.
talking about it, it must be bad. And they feel like it's dirty. Or if I told you how many times women apologize to me for the way their vulva looks when they come to see me, like when they
Mm.
come to my brick and mortar business. And I'm like, the last thing I want you to do ever is apologize for just your anatomy looking a certain way. Like
Hmm.
that's hard. And so that probably does lead to lack of desire in maybe 50% of the people that I see, that at least a component of their lack of desire is just their physical image. And then you can have
Mm.
low desire, the other half, it probably half is relationships and talking about it and cultural
Hmm.
things and all of that
I think
as
that's
well.
a big struggle we see is, and I'm sure you see it a lot too in your practice, is that communication, it just isn't talked about, and it's not acceptable necessarily to talk about. And you know it, it's just, I mean, it's still something I'm struggling with, something that I've been dealing with for a couple of years, getting more comfortable, almost to an extreme end. And I'll say stuff in front of my kids and everything now too, because I'm just like, no, you have to talk about it. I don't want them to grow up and not talk about these things, because it has to become the norm. I
Mhm.
mean, I'm not talking to them about stuff with regards to me and their father intimately. I'm just saying, just in general, discussing sex and your body and pleasure and making things normal is not commonplace. And I think that it seems to me, at least, that it results in a lot of issues with regards to communication with your partner that are kinda like tenfold. It's like, when someone's upset about something and you can tell, "This is not what you're really upset about. This is something else." And I wonder if a lot of that has to do with intimate relationships and the inability to communicate those things to one
Mhm.
another.
Mhm. Like when you think about it, it's hard for most people to come up with anything else that you grew up talking about without using the real names for something, right? Like it's
Mhm,
taboo to talk about finances. I'm going to start talking about my husband and I's personal finances at a dinner party, right? But we don't come up
mhm.
with nicknames for it, you know? Like
Oh, good
don't
point.
call it your 401k, call it, you're a dingle hopper, like
Yeah.
that would be ridiculous, right? So, what
Right.
else in your
Mhm,
life is so taboo that you don't even mention it by its real name? Like it's your hoo ha, your lady bits, or your whatever. And it's just
yeah.
like the first step that we can do if there are parents listening is by just, vagina and vulva, and knowing the difference is helpful. regardless of all the other parts as well. But in penis
Mhm.
and scrotum, I have two sons. And so ever since forever, when they it's like, that's your penis and that's your scrotum. And
Mhm.
then when something is bothering them, and it has with both of them before, and they've come to us and
Mhm.
said, my penis hurts, or one of my sons like closed his scrotum in a drawer,
Oh
which
boy.
is awful, right? But he like
Right.
doubled
Yeah.
over on the ground, and I was like, "What happened?" And he said, "I pinched my scrotum." And I was like, "Oh my God, that's
Oh.
awesome that you're 6 and you just say it." And he's not like embarrassed about it. I said, "Okay, like what can we do about it? Let's put some ice on it. Let's get you a popsicle." Like not a whole lot we can do about it, but
Well, and you start it young like that, and then they, like I said, that's why I do this to my kids, and sometimes they're annoyed by it. But the thing is then they can step into relationships and be like, "Oh no, this is how we talked at home.
Mhm.
So why wouldn't I talk about this here? With someone that I'm much closer with, much more intimate with than mom and dad."
There are
I
also
think
a
that
lot of
that's.
studies that show that decreases the effects of child abuse, or the chances of child abuse, when you are actually using correct words. It's things that they can talk about it. Then the second that there's something wrong and they didn't like that happened in those parts, they come and talk to you about it, because it's totally fine to talk about those parts.
Mhm.
And when we put a lot of shame around it, and then somebody's doing something that we're not even allowed to talk about, then
Right.
you wind up with more abuse. So I think for some parents who are on the fence and they're like, I don't know, that feels a little wrong to just use real words. I think when you appeal to their senses in that way, it is helpful.
I actually saw this on your website. You said it was 7 essential tips for, I believe it was pain-free, pleasurable sex.
Mhm.
So what are those 7 tips?
Well, so some of it starts with having the conversation, right? So,
Mhm.
um, and that probably is the hardest part. Another one of them is environment, so that it's wherever you're going to have sex. So this gets back to your body image question, right? So and I'll kind of delve into this one because I think it's probably the biggest for right now for women, is making sure that if you're not comfortable with the way that you look, then you're setting up your environment so that maybe there's dim lighting, right? Maybe there's music so that you can feel relaxed, right?
Mhm.
You have everything ready at the bedside stand. Like these are things where it's like you need to come prepared, so that if you do need lubrication, or you do need a vibrator, or you need something else, that you're not getting up while you're naked and walking across the room. If that makes you feel uncomfortable, because those things, that could be the trigger. That could be what makes you
Mhm.
kind of shut down, and then tightens up your muscles, which is another cause of pain that we didn't cover, but that's probably the biggest cause of pain. Um, so we're trying to change the environment, we're trying to change the conversation, and get to a point where people just, they've created the perfect space.
You said with the tightening, at first thing I made me think of is when we get stressed and our shoulders get tightened. Is that something similar to what's going on downstairs?
Yes, I feel like, did you read that on my website?
I
I'm,
actually
I'm
I
sure
might
that
totally
is.
might have. I can't remember right now, but when you said that, I thought, I know how I am. Not I do have body image issues, and so I know what I'll do, and you feel like I can squeeze your butt cheeks or whatever. So it made me think of, oh, when I get tense, I'll squeeze my
Yep.
shoulders, and then I need someone to work those knots out of my
Yeah.
shoulders. Not quite the same ball game with downstairs. So exactly. So what muscles are involved in tightening like that? First of all, is what I'm curious about, and then what can we do?
So those are the muscles of the pelvic floor. Collectively, I think it's best for um, patients and lay people to just say pelvic floor muscles, or your puborectalis, and these things that don't really make sense to people. There are a few muscles there that, but they operate together. So um, and they're your deeper pelvic floor muscles. And it is a lot like your shoulders. And I use that analogy all the time. And one of the things that I think is really interesting is we're not the only people who contract our pelvic floors or we're not the only animals, right? Actually, if you look at all mammals, like if you look at your dog or your cat, if they get upset and they're startled, their shoulders go up. That's the same thing we do. Our shoulders go up. Their tail goes down. That's the same thing we do. The muscles on our tailbone tug it down. And we do that same. So they're kind of these postural muscles. And the other thing is that they clench their jaw, and we do that too. And so those three areas of the body, I always talk about relating those. And I have dealt, and I worked in a chronic pain management program for a long time. And those are the areas that I really focused on was, jaw muscles, shoulder muscles, and the pelvic floor. And it's one thing for you to be startled and go, and you'll do all three of those, right? But if you are sitting at your computer and you're stressed and you're holding one or two or all three of those, that's when you set up the chronic pain. That's when you set up trigger points. And so if you've massaged somebody's shoulders and you feel like there's like this crunch or like a rubber ball in there, the same thing happens in your pelvic floor. I can usually talk a partner or a woman herself with the use of a special wand to find those areas and work them out. And they feel similar to what you would feel in your pelvic floor or in your shoulders.
In a situation like that, what we're going to see then when, say, for example, you use the example of a woman getting up and having to walk across the floor to go grab something and being uncomfortable with her body being seen at that point. So then what's going to happen is you refer to it as a trigger.
Mm-hmm.
And so then we have a drop in desire
Mm-hmm.
or feeling desirable, I guess, as well.
Mm-hmm.
From there.
And even if she's still having sex, that is going to make her orgasm so much harder. The fact that she has lost confidence, because orgasm's happening between your ears so much more than it is happening between your legs. It can be a sensation issue. And definitely I'm always talking about sensations, the areas that have the most nerves and most, men and women, and stimulating those areas. And sometimes you've stimulated 90% and you just need that extra 10% and all of that. But at the same time, if what is happening in your brain is working against us, oh my gosh, it's going to be an uphill battle, right? So
right. Yeah.
I used to, when I first started out, I was very much talking about physical. And as soon as, about 7 years ago, I really shifted to talking about both the physical and the mental side. And that's when real success was like, wow, this is making huge changes much faster.
It makes absolute sense, though. I mean, you can think about it with regards to lots of different things, but especially when you're talking about sexual intimacy, what goes on. I know what goes on in my mind. So if it's something negative with regards to self, it's absolutely going to have. And then are we going to discuss these things with our partner, or are we just going to struggle through and not address that? Hey, I'm struggling here, and it's resulting in a lack over here, kind of an issue as well.
One of the things on that 7 things to do to change that part of your sex life handout is about stress, because the other thing that women tell me all the time is that, if they're not worried about their body, they're thinking about the laundry that they have to fold and their grocery list. Like, I've had so many women tell me that they're honestly like thinking of the things that they need to be doing when they're having sex. I'm like, that is not living in the moment. So we need to focus. You can't always live in the moment, but if there is ever a time to live in the moment, it is while you are having sex.
Right,
you should be living in the moment.
Oh, I can definitely see that. I'm thinking, which child's going to walk in the door or knock on the door? My kids are older, but they still, it's like, hello, the door still gets knocked on, and what are you guys doing in there? It's definitely. So then my mind is like, okay, we've got about 5 minutes before the youngest one, comes pounding on. So then your mind is, what time is it? It was 4 minutes and 30 seconds. Okay. Oh, wait, look, it's 2 minutes and 25 seconds, so yeah, that's definitely mind and body are connected 100%. And then with regards to those tips that you had, thank you for sharing a little bit about those. But those can be found on your website. They can put in their name and email, and that's something that can be emailed to them, correct?
Absolutely, yeah.
One thing that you and I had discussed was the idea of empowering women through this practice that you have, but also with regards to having pain-free, pleasurable sex, and finding ways to, if therapy is necessary, or ways to find out whether or not it's lack of desire because of a problem that they're having. But if you were able to talk to women and empower them and explain to them there are ways to get through this, what would you tell them?
Gosh, it's so hard to give like one best tip.
Oh,
If it
can
came,
give a few.
okay, if it came to, good, thank you. When it comes to body image leading to desire, one of the things that I wish every woman knew is that you are your own worst critic. You see flaws that no one else sees. And I mean, no one,
Mhm,
not even your partner. So, the other thing I would really love all women to do is to be their own best friend. You say
mhm,
things to yourself that you would never say to your best friend or anyone. It's like, wow, that
mm.
bitch, I can't believe she said that,
Right.
you know? So, check yourself. It's like, God, would I ever say that
Mhm,
to a friend? You know?
mhm,
Um, and then I think a third great point would be focusing on how your body feels more and not so much on how it looks, right? Even if you
mhm,
think your body looks great, well, if you
mhm.
focus on how it feels. Do you feel good right now in the moment? And how can you feel better?
The idea that we can look at what's going on with our bodies, whether like you said, even if you feel like it looks great, do you feel great? And that we have and possess the ability and the tools that we need to address it so we can feel great as well as look great. And I think that we forget that sometimes. So tell me, where can we find you? Where can we connect with you? And explain to me too a little bit about how you do, not just in practice inside your, brick and mortar,
Mhm.
but you do email and chat and video chat and all that.
Yeah. So you can find me at drlaurenkrigler.com. Krigler is Crigler. And I'm also at Dr. Lauren Krigler on Facebook and Instagram. And I have a free Facebook group for women who are struggling with any problems in the bedroom. And really, we talk
Mm,
about relationships as much as we talk about sex. So I encourage
okay.
people to find me there, find that group through my page on Facebook. And then, yes, I actually, well, now that we have coronavirus, I was transitioning away from spending time in the clinic and really focusing more on coaching online,
Hmm.
because it allows me to, it actually allows for teaching in a better way when it comes to sex, especially.
Hmm.
There is something about not being in person that is actually helpful. People open up more, and it allows for more partners to be involved. So that's
Mm.
really helpful. And now that we have coronavirus, it's all online. So it's kind of cool because I've been able to get some people who were brick and mortar and go to online coaching. They're like, oh, we should have been doing this all along. This is way more convenient. And
So now you would be able to connect with people that aren't in your state because you're in Georgia,
right.
correct?
Yeah. Yeah.
And so people could communicate with you and connect with you with regards to coaching and whatnot. And they can do that from any state
Yep.
then.
Absolutely.
You had shared on, I believe it was Facebook, with regards to something you're doing for pregnant women right now.
Yeah. So, funny thing, a consequence of sex is getting pregnant. And so, so I don't leave women hanging
Strange.
because I'm
Yeah.
all about pelvic health. So a good number of my patients and the people that I coach are pregnant. And then of course, my husband being an OBGYN, I can,
Hmm.
we do a lot of working together on that. And we sat down like a week ago and said, what can we do that would make the most impact, that would really help our mutual like patient population, but
Hmm.
globally? And we came up with, the idea of having a pregnancy course where women are learning the physical therapy things that they would normally come into, often they would come into a brick and mortar business, and all of those are closed and probably will be for a long time. And since I am
Hmm.
already really accustomed to teaching online, it just makes sense to, why don't we do this online?
Hmm.
All the same principles. We can include the partner, but making it available through a course obviously makes it easier to reach more people. So
Hmm.
we have a free mini course that people can take that really goes over some pretty critical musculoskeletal issues that pregnant women deal with, like low back pain. You know, I
Mm.
don't know any pregnant women that get through pregnancy without it, but like you said, they
Right.
don't know that there's help. You
Mhm.
don't have to suffer with back pain. You can do something about it.
I was very excited when I saw that because again, I didn't know anything like this existed for me. I think I heard some people talk about chiropractic stuff when I was pregnant with one of my kids or something like that, but I wasn't something that I was interested in. But the idea that there's something else that can be done that actually is healing is fabulous to me. That's not something that's not temporal, you know what I mean? And
Right.
I think a lot of women could benefit from it. I love that.
Right, exactly. If you take medication for low back pain, that's just masking the symptoms for a short period of time rather than changing the problem.
Thank you so much. I am so excited you came on today. Thank you for being here so very, very much. And again, they can find you at
Mhm.
drlaurenkrigler.com. And then you have your Facebook and you have Instagram,
Yep.
correct? Those are at Dr. Lauren
Yep. I
Crigler.
keep it so simple.
I love it. Thank you very
Thank
much.
you so much for having me. I really enjoyed our conversation.
Thank you so much for listening in today to this episode of That's Not Proper. Remember to take a look at my website, that'snotproper.com, and sign up for the newsletter. There's also an area there where you can send me a voice message, ask me a question, or tell me why you want to be on the podcast. If you are interested in speaking with Dr. Lauren Crigler, I'm going to be including her information in the show notes. That's drlaurenkrigler.com, and her Facebook and Instagram are also at Dr. Lauren Crigler. Join me next week when I'm going to be speaking to a really, truly wonderful woman whose husband is currently incarcerated. And she's going to be sharing with us that story as well as how she has changed the narrative with regards to her own personal life. And she is empowering other women towards health, wellness, fitness, and self-care. Thank you once again for listening in to That's Not Proper.